bridges we burn, we make mistakes, then we live and learn. When life gets tough and it seems like your best ain't good enough, if you're in need of hope, you know where I'll be right here, right here. And when you need a friend, you can count on me. I'll be right here, waiting for
you. This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening and viewing friend. It's so nice we can meet each other on the air on this beautiful best day ever. And for those of you who are tuning into the classroom for the first time, please know I've been waiting for you. This is a special place where you can go to when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening and viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Now, a while ago, I learned about Annie Appleseed project that we've talked about. We spoke to Ann Fonfa last week, and now today we get to speak to one of the teachers at this event. And that's going to be on February 23rd, 25th of 2023 in West Palm Beach, Florida. An amazing time. And you get to go into a place where you can learn and grow with like-minded people that will meet you where you're at. Well, along comes in Dr. Linda Isaacs, who I've learned through that she was going to be one of the speakers. And I thought, you know what? I want to learn what she knows, and I want to bring her and introduce you to all of us so that we can learn from her today. And hopefully you will make a decision to attend the conference on February 23rd through 25th in West Palm Beach, Florida. And so a little bit about Dr. Isaac. She worked with Dr. Nicholas Gonzalez, MD, for over 20 years. And together they came with these protocols that would end up reversing stage 4 cancers, changing people's lives. And it caught my attention many years ago. And I've kind of stopped doing classes on cancer, but who do you not know that hasn't been affected? Who do you know that has been affected by cancer or disease? Well, today we are learning from our teacher, Dr. Linda Isaac, MD, who is board certified in internal medicine, but has spent her life trying to help people find their path to health. And since it is our sole purpose in life to give and receive love and knowledge, I am so grateful that Dr. Isaac is here to do just that. Welcome to the classroom.
Well, thank you so much. I was really looking forward to speaking at the Annie Appleseed conference, but now I get an extra bonus for having agreed to do that, and that's that I get to meet you and be on your show.
Yes.
So thank you so much for all of those wonderful goals and dreams for all of us that you mentioned already. Awesome. And I look forward to speaking with you today.
Yes, thank you. So share a little bit about your background and what led you to this, because you're conventionally trained.
That's right. Yes, I am conventionally trained. So I have my boards in internal medicine. I've actually recertified a few times, most recently a couple of years ago. But my whole professional career has really been spent on offering the kind of treatment that's nutritionally based. And I wound up getting into this because when I was a third-year medical student, I met Dr. Nicholas Gonzalez. I was assigned to an internal medicine team for my training, and he was the intern on the team. But he was also engaged in doing research about a particular practitioner, a man named William Donald Kelly, who was an orthodontist who wound up developing a method of treating cancer for himself. And then people started flocking to him to learn what he'd done because he got better. And so Nick was engaged in going through Dr. Kelly's records at the time that he and I met. And there were some amazing cases in his records. That's what shifted my frame, my goals from just being a regular doctor, in effect, to doing this type of work.
You know, it takes a great person to take their what they think they know,
Mhm.
and dive and be curious enough to learn what others may know they know that you don't know. And I always say, how do you know you don't know it? How do you know it if you don't know it? And so good on you that you were open enough, because many doctors spend hundreds of thousands of dollars in their education, and they're fearful of stepping outside the box because they might lose that credential.
Yeah, that's true. I think perhaps part of what made me a little bit more open-minded, a couple of things. My mother had been interested in nutrition for many years,
Mm,
and she had actually developed an arthritis when I was maybe in seventh grade. I don't remember how old she would have been at the time, but her brother, who was a physician, actually told her to try taking a calcium magnesium product, and that actually helped her tremendously. And so she got more and more interested in nutrition as the years went by. So there was that. But also, I remember when I was a first year medical student, I was sitting there listening to a lecture that happened to mention a particular piece of information that I knew was only theory, because I'd worked in a laboratory as an undergraduate that was trying to prove that theory. So I knew it was theory, but it was presented to us as a given, proven fact. And that made me wonder, well, how much of what we're being taught is absolutely solid? And that just gave me, a bit of open-mindedness, I suppose, willing to listen to something that was outside the box. Sometimes people have the attitude, well, if this is so great, why isn't it at Sloan Kettering? The thing is, it takes years for new ideas to get into the mainstream. And that's just the way it is. But after learning about what Nick was finding in Dr. Kelly's records, I came to believe that there was something to it and it needed to be followed up on. And then, of course, there's years worth of our own results that reinforce that.
You're the second person that's been on that I can note, that has been profoundly impacted by someone who's a dentist. Dr. Thomas Levy is one of them.
Mm-hmm.
And it was Hal Huggins that he learned from him, and basically walked away from his practice of cardiology because he saw that this man was taking care of his patients in a way that he would never know, that he was not able to even help as much as a dentist was helping. And so I don't know if you've heard of Dr. Thomas Levy. We're doing an event together where he's teaching his protocols to other doctors as well, that he learned from a dentist, a biological dentist. So with this, how easy was it for you as an MD to sit back and say, okay, this could make sense? How long did it take you for you to say to Dr. Gonzalez, I'm all in?
Well, it was a kind of a gradual process. It's hard for me to put a finger on that. Like many other practitioners that diverge from the mainstream, part of what happened also was that I myself got sick. I had worked in a biochemistry lab as an undergraduate and was very careless with a lot of chemicals. And then also I had secondhand smoke from the time I was conceived until I was like 19 years old. Both of my parents smoked. And so I wound up getting quite sick by the time I finished my medical internship. And so I went on the protocol that Dr. Gonzalez and I offered all those years. Dr. Kelly is who was guiding me at that point. But I went on it to get better. And so I had my own personal experience of recovering. I didn't even bother to go see a regular medical doctor because I was a regular medical doctor and I knew they would just tell me I was depressed, and there was so much more than that. But I went on this program, I got better, and that too helped persuade me that this was something that needed to be followed up on. So I guess there wasn't a moment where a light went off and I said, oh, I must go on this path. Bear in mind too that I really value my orthodox training.
Sure.
Obviously, having recertified multiple times in internal medicine, I obviously value it. So for me, it's not an either or situation. It's more what works in any given situation. That's what I'm looking for.
Right, great. So let's talk about the principles of what you're doing and what you've learned for all these years. So let's start with diet, because many doctors, and I've heard them say it, not on the classroom, because we only bring doctors that are open to alternative approaches to, if this doesn't work, what else will work, and start doing something natural first and then escalating as the need arises. But many doctors, and I've heard them say, you're going to have to take this pill for the rest of your life. Diet doesn't mean anything. You don't have to change your lifestyle. I've heard that over and over. And maybe also the patient is interpreting it too, because maybe the doctor has no idea on how to help them nutritionally. So what do you say? How important is diet?
Well, I think diet's extremely important. And I know what you mean about some doctors will tell you it's not, especially when you're dealing with something like cancer.
Mhm.
But in the last few years, there have actually been a few articles that will support that diet matters, even in the setting of standard treatment for cancer. With what I do, it's extremely important. But even those of your audience that might be getting chemotherapy or immunotherapy should really know that it matters. It does matter. I believe, part of the problem can be that doctors themselves don't always eat very well. They're living very crazy lives, and many of them working extremely long hours. And so they can wind up just grabbing whatever to eat and feeling like, okay, if I say that diet matters, I'm going to have to do something about my own life. It's already known that doctors that don't exercise don't tell their patients to exercise. So that can be part of the issue as well.
I have this saying that if your doctor doesn't look healthier than you, fire him. It's like, walk away fast. This is a true story, and I could not make this up, but I grew up with asthma my entire life. I had asthma my whole life. And it wasn't until I interviewed Dr. Andrew Saul, who said between commercial breaks, because I was in radio at the time, he said, Lily, I can get you off all your asthma medication. I remember I was on this drug called Xolair, which later was similar to chemotherapy. That's what I learned later on. It suppressed your immune system and all that. I was looking, I used to live in a different place. And when I came to Brevard, I was looking for an allergist that would prescribe, give me the shot for this drug, which I don't recommend anymore. But I finally found an allergist in Brevard County. I went into his office and I was like, smelled like cigarette smoke. The man smoked in his office.
Ooh.
An allergist.
Yeah.
I couldn't make this up. I could not make this up. So with that in mind, I always say, we have the power. I would never go to a morbidly obese weight instructor, like a exercise instructor. I would never do that. Why would we go to an unhealthy doctor? And we need to hold our doctors to that higher standard. And you're right. Do as I say, not as I do works a lot, but not all the time. So how do we get doctors to be interested in nutritional science, which is what you're advocating as well?
Well, I do think the world is changing bit by bit on that. So I don't really know what more to say on that subject. I think doctors recognize that they need to do better on it. But I think partly too, there can be kind of a vicious circle in that they think that the patients aren't going to do it. And meanwhile, the patients are saying the doctor didn't mention it, so it must not matter. So it kind of goes in circles, so to speak.
Yeah, it does. So what are the aspects of diet and nutrition that you highlight? Are you looking for? Because as I was researching you, I noticed that you're not stuck to an individual way of eating. Do you test their metabolic type so that you know what is best for their body, or how do you come up with a diet for that individual?
Yeah, part of the underpinnings of what I do involve the effect of diet on what's called the autonomic nervous system, which is the functions of your body that you don't consciously control. So, like if you want to move your hand, you think of moving your hand and your brain takes care of it. But we don't think about telling our stomach to digest food or our heart to beat. Those things happen in the background. But there is an aspect of nervous control to that, and that's the autonomic nervous system. And so diet can affect the balance of that autonomic nervous system, as can supplements. And so I guess I'm trying to decide as I'm speaking how complicated to get here, because it does get rather complex. But people that tend to have an overactive sympathetic system, and they're the people that are very hard driving, wired up, generally in a state of overdrive, like an Energizer bunny. Those people tend to do better with a more vegetarian diet. Although I never tell people to go vegan. I think that's too extreme for almost everybody. But those people with that overactive, wired up physiology do better with a more vegetarian diet. But there's another group of people, the more extremely mellow people, the people that can fall asleep in the middle of the afternoon every day and are generally easygoing, relaxed. They tend to do better with a higher meat content in their diet and more acid forming diet. Then there's a spectrum in between. Many people are more in the middle.
Interesting.
This is all based on Dr. Kelly's clinical observations, and it even goes back further to a man named Dr. Francis Pottinger, who did some studies in the 1910s, 1920s, 1930s, along in there. And that was before medicine decided that everybody's the same and that we all need the same drugs. There was kind of a shift from the idea that different people are different, which was not uncommon, that people thought that way, doctors thought that way in the early 1900s. And then when pharmacology came in, well, you want everybody to be the same because then you can give them all the same drugs. Now with genetics, genetic information, we're starting to see some changes even in the regular medical world. So I think the idea that different people need different diets will become more accepted over the next 5 or 10 years. It's already getting there.
I think so. I really do believe that. What kind of testing you can look at somebody's personality and kind of like put them in that, like as you can imagine, love vegetables. So I thrive on a more vegan diet, but I am not a vegan. I'm whole food, plant-based in many ways, but I do not deny myself. And I just make sure that it's as healthy as it possibly can be. But there are people that maybe like my husband, who thrives on more of a meat. Do you do any testing outside of their personality wise?
We can really tell a lot from personality, at least I can, having done this work for a long time. We do have some tests that we use, and blood work, just standard blood work, things that looking at things like sodium, potassium, those types of values can give some clues as well. Dr. Kelly used all of the above for his methods of determining where somebody fell. But another consideration is really just asking people what they feel best on. The people that really get into trouble with diet are the ones that will be paying a lot of attention to whatever's billed as healthy in the latest book and not listening to their bodies. And I'll also mention that it's not as if the people I put on a carnivore diet are ignoring their veggies altogether. They do well with vegetables. It just depends on which vegetables. They're the ones that if they eat a salad an hour later, they feel like they didn't eat anything at all, because their digestion tends to be fairly brisk. And so they need something more solid like protein and fat to continue to do well an hour after a meal.
Yeah. Okay. So So what about processed foods? Because, we're really, there seems to be this, even the vegan community, even they're saying, oh, you can have this because it's vegan, but there's so many chemicals in the vegan product. They're doing the same thing for these products that the standard American diet is doing for the regular processed stuff. So what is your advice for people as they want to clean up their body and using diet and nutrition for that?
Yeah, I think there's more and more data that says that processed food is really bad. If you think about it, is it really normal that food can sit in a box on a shelf for months on end and still be okay to eat? It doesn't make sense. And, I think the strongest advice I can really give people is learn how to cook and make it yourself. I know it seems like a lot of work and energy, but being sick is a lot of work and energy. And I really think that you're much better off eating food you made yourself from scratch.
Very good. Very good. Okay. So let's shift a little bit now to supplements. That's the next step in your protocols. Is this something, because I was reading that there's a lot of supplements. Let's talk about your ideas of what is optimal for health.
Okay. Well, as far as supplements go, the numbers of pills to swallow that are quoted on my website is talking about somebody with cancer.
Mm-hmm.
And the backbone of what I do with cancer patients is large amounts of pancreatic enzymes. Now, I'll be talking about this quite a bit in my lecture at the Appleseed conference, and I don't want to completely scoop my lecture. I hope people will come and hear it.
Yeah.
But that's the bulk of the capsules that people are swallowing. We use supplements though. Magnesium, potassium, calcium supplements can help adjust that autonomic nervous system that I was talking about earlier. And then something that I use a fair amount of are products called glandulars. And glandular supplements are, in essence, freeze-dried animal glands.
Mm-hmm.
So, for instance, you could have a freeze-dried adrenal, freeze-dried thymus, the master gland of the immune system. Any of these glandulars, there's a lot of different ones, but they're a big part of what I do, because I think they can really be helpful in terms of managing, fatigue syndromes, for example, or people with autoimmune issues, people whose immune system isn't strong enough. All of these things can be helped by glandulars, I believe.
Wow. So you had mentioned how many pills do they take? Between 100 and
For a cancer patient, it's between 150 and 200 a day. The bulk of them, though, are those enzymes, and those are taken in multiple doses over the course of a day. It's not like you're sitting down to eat a giant bowl of supplements all at once. But this is not a program for people that have trouble swallowing pills, that's for sure.
No, but can they open them up and put them in a stew or something where they can make it into a porridge?
Yeah, for some of them that can be done, but the enzymes specifically need to be taken away from food, and they don't really mix well in water. So I have a few patients that do that, but for the most part, people that try to do that don't last very long. It's just a lot of work.
Okay, so when you're seeing pancreatic enzymes, what is this because people have pancreatic cancer, or is it because our pancreas malfunctions when people have cancer? What is the concept of pancreatic enzymes?
Yeah, the idea behind it is that pancreatic enzymes, the enzymes that the pancreas makes, are part of our defense system against cancer and can be part of the mechanism of treating it if we develop it. And again, I'm going to go into this in detail, although people can also visit my website. I recently wrote an article on this very topic that was published in a journal that's listed on Medline, on PubMed, the National Library of Medicine.
Mm-hmm.
So it's a rather lengthy article. And if somebody wants to get into the serious depths of why pancreatic enzymes might be helpful for cancer, that's a place to go. So my website, www.drlindai.com.
Mhm.
So the idea behind it, though, is that pancreatic enzymes are part of our surveillance mechanism, and that would be true not only for pancreatic cancer, but for other types of cancer as well.
Very good. So if somebody doesn't have cancer or somebody wants to prevent getting sick, how do these pancreatic enzymes work in their life? Will it work? Does it fit in?
I think that everybody would benefit from taking some pancreatic enzymes with their food just to help them digest their food, because that's one of the big roles that pancreatic enzymes have been known to have in the body for 150 years. But what taking them can also do is, in effect, free up your body's own reservoir of enzymes to be used systemically instead of just on food digestion. So I think a few pancreatic enzymes with meals are an excellent idea.
Are they called pancreatic enzymes, or what they do is help the pancreatic enzymes? So is there a name for it? Is there a particular product that you sell in your group, in your clinic?
I don't sell enzymes myself, and I actually am very careful about not wanting to make money off the enzymes my patients take.
Good,
They
good,
take a lot, and it can start to get into a conflict of interest.
good.
The people that see me buy their supplements from a small company that actually only works with my patients. But the closest commercially available product is from a company called Allergy Research Group. They also sell under the label Nutricology, and the product name is Pancreas. There's several different versions that they have. The pork version, I think, is the most effective, and so those are actually available on Amazon.
And they're called pancreas.
Pancreas. Yes, it's a very simple product. It's basically freeze-dried pancreas, and so it naturally contains the enzymes that the pancreas makes, both in their active and in their precursor form. So it's a good product.
And that helps with food digestion?
Yes, it does. Uh-huh.
Okay, so how, because I've been told that like pineapple, what is it, bromelain works
Mhm.
with food digestion. Is that a pancreatic enzyme too?
No, bromelain is a plant-based enzyme, and so those enzymes will do slightly different things. So the pancreatic enzymes are made specifically by the pancreas, and so some of the names of those enzymes would be things like trypsin, chymotrypsin. Those are different from bromelain.
Okay, so help me understand, because I'm learning from just like everybody else. Um, how does a pig pancreatic enzyme
Mhm.
or another animal's pancreatic enzyme assimilates to mine? To how does it work in my body when I'm not a pig or another animal?
Well, the enzymes are not all that different either.
Okay.
In other words, I suppose, if you were talking about a snake, for example, that might be very different. But in terms of our relationship to a pig, we're not that far off.
No, that's why
I
that's why we
mean,
have pig valves.
perhaps
Yeah.
in some cases, they're more like pigs than others, but in other words, the enzymes are not that different.
Yeah.
So in terms of their function in the intestinal tract, they'll still be getting the same job done.
Interesting. I just had to dig in a little deeper because I had never heard that before. And so I'm always so curious as to, what somebody knows that somebody else doesn't know, and it's working. So with the pancreatic enzymes, and this is a major part of what you guys are doing when it comes to supplements, what kind of results have you ever treated somebody with a stage 4 pancreatic cancer, for example, that we've heard is uncurable?
Yeah, well, one of the patients that I frequently talk about is a woman who was diagnosed with pancreatic cancer in December of 2000. She actually had a very astute physician who heard her complaints of an unintentional weight loss. In other words, she wasn't trying to lose weight, but she lost weight, 25 pounds. And she also had some vague abdominal symptoms. And so she was sent for a CAT scan and discovered to have pancreatic cancer. Now, bear in mind that, I mean, strictly speaking, her pancreatic cancer was stage 2. But with pancreatic cancer, you know, the natural history of the disease is that stage 2 turns into stage 4, you know, metastatic within a few months. So, so anyway, she was diagnosed in December of 2000. She started with me the following March or April, and she's still alive and doing great. I spoke to her just a month or two ago.
Wow.
I actually recently spoke not only with her, but with her granddaughter. You know, she had asked if it would be okay if her granddaughter gave me a call, because her granddaughter's interested in health and nutrition. But her granddaughter was actually born around the same time that she was diagnosed. So she was able to get to know this person because she did this protocol, and she's still alive when she really should have been gone in 2001. That's the natural history of that disease.
Wow. And so as you are helping these people and people that are they're following their diet, and they're now loving their supplements, and they're taking it religiously, because you know, is there increase of success when they now add detoxification to the whole process? And what does detoxification look like for your
Right.
patients?
Well, the idea behind detoxification is that, first of all, we live in a toxic world. So there's a lot of stuff that's in our body that's interfering with our ability to heal. But secondly, the idea is that when the enzymes do their work, they create waste materials, metabolic debris that forms as the enzymes go after cells that need to be disposed of. And so Dr. Kelly, our predecessor in this work, he actually realized that something like that was going on for himself, because he had lost 50 pounds and had a tumor sticking out of his abdomen. That's the position he was in when he started experimenting with diet and with supplements. And so what happened was he started taking a lot of pancreatic enzymes because his digestion was terrible. And he needed to help just be able to digest food. But then he noticed the character of the tumor was changing. But then as he kept taking lots and lots of enzymes, he found that he started to get really sick. He felt like he had the flu. It felt like he'd been, run over by a truck. He was nauseated. And so he stopped taking the enzymes, and those symptoms went away. But then his tumor started to get worse. And so he realized it seemed like the enzymes were creating some kind of situation in his body that was making him sick. So then he decided to start doing coffee enemas. That was the backbone of his detoxification efforts. And it's the backbone of what I tell people to do as well. Another thing I'll also throw in there is the quality of the diet. So I recommend organic food, no processed foods, and et cetera. Because when you're eating food that's not the best quality, then you're just bringing stuff in that you have to then get rid of. So it ties into detoxification as well.
It's amazing that Anne Fonfa is so committed to this, that everybody that gets to go to the Annie Appleseed Project conference on February 23rd through 25th to 25th, 2023, is going to have organic food, no processed food. You're not allowed to even bring food in, because we want to make sure that all the as we were talking today today, and I said to her, she was talking about some people brought Pepsi. People bring Pepsi in their package, and they're like, no, you can't bring this in here. And I'm like, it's like inviting Satan to a convention of saints. It's like, come on in. Oh no, you can't come in. So yeah, we do this all the time. What are some of the foods that are like, people think they're healthy, but are there any foods that people still think they're healthy, but they're not, that you say, no, that it becomes a shocker? Is there one that is a reoccurring one?
Well, I think the fad for soy has worn off to some extent, but I know I used to have a lot of conversations with people about that one. And the issue with soy is that it contains an enzyme blocker that is very potent against the enzymes that I'm recommending that people take. So I'm not a big fan of soy products for that reason.
No tempeh either,
You know,
even if it's organic?
well, theoretically, some of the fermented soys would be okay, but on a practical level, Dr. Kelly told people not to eat soy, and we've told people not to eat soy. And so if I started saying things are okay, and then I don't get as good a results, I'm not going to know what the issue was, so to speak. So I'm really not a big soy fan.
Oh, interesting. I love tempeh, and I prepare it, but I make sure that it is absolutely 100% organic. But who knows these days what we're eating, right? And so
Yeah,
are you saying
you do the best you can.
you
Yeah.
do the best you can? Absolutely. And when we do, and this is something that I notice that people do, it's like let's say they decide that they're going to go off their nutritional diet, or they're like guilt themselves the whole entire time. And I'm like, listen, the guilt is worse than the piece of whatever you're putting in your mouth, So how important is the emotional aspect of a person? Do you deal with and do you work with somebody's, past traumas, past disappointments, and how do you handle that in your clinic?
Well, I'm not a therapist, and I'm not really trained to be the one that's guiding them through whatever process they need to go through. But I do think it's important for people to think about those issues. And what I find is that many times, when people first come to see me, and this is cancer patients or not cancer patients, because I see people with fatigue syndromes, for example. And so many times, as their body starts to recover, the issues with emotions, past traumas, those types of things will come up. And I think it's important for people to go ahead and deal with stuff as it comes up. To try to think through things like faith and hope and forgiveness. All of those things can be very, very important for patients. But people have such different ways of coping that I'm not terribly prescriptive. Like I don't say, go read this book or, whatever. It's more just encouraging them to recognize that this can be an issue and to put something into practice when it comes up.
Very good, very good. Well, before we continue, because I really do want to ask questions about case studies, and but I want to encourage all of you to go to whenyounneedafriend.com. When you go to whenyounneedafriend.com, you have all of Dr. Isaac's information. Every week I send out a blog, and it tells you you're the first ones to find out who's going to be the teacher in the classroom. So go to whenyounneedafriend.com. While you're there, please subscribe if you haven't done so, because you get lots of different gifts as well. And then while you're there, please like and follow me on social media. Share this information, because if I ask you if you know somebody who's been shot, many of you wouldn't raise your hand. But if I ask you how many of you know somebody with cancer, I would say everybody would raise their hand. So please share this information, because you don't know if this information could be life-saving for that individual, that all of a sudden is going to change their lifestyle. So go to whenyounneedafriend.com and do that. While you're there, please check out my sponsors and that are supporting the classroom. So please support them as they are supporting us. And we have the Shop Now bag. We have lots of things that are going on in the classroom. We have Dr. Thomas Levy's Optimal Health conference that we're doing for doctors and practitioners to learn protocols. We're also doing the I Am the Solution workshop. It's continuing education of the soul. So if you know somebody, Dr. Isaac, that would like to attend the weekend, we address issues of our life that we just want to embrace. And we also, we have on the 23rd through 25th, Ann Fanfa with Annie Appleseed Project Conference, and you'll get to hear Dr. Isaac. I think you're talking on Saturday, aren't you?
That's right.
That's right. That's right. So please go check out everything that's at whenyouneedafriend.com. And finally, you can become an enrolled student in the classroom. So whether it's $1 or $1,000 a month, whatever you can donate, whether it's a one-time donation or it's a donation of your time, your talent, your treasure, everything is appreciated. Today, we are talking to Dr. Linda L. Isaac, MD, and you can find her at drlindai.com, and you can learn more about her protocols. There's some videos there. And so please check her out and go to the conference as well. I mean, the price of admission is worth, for the food alone is the price of admission, but you'll be there with like-minded people. If you know somebody in Florida that you can just drive to West Palm Beach. I know that we're driving from Cape Canaveral, and it's a beautiful drive. So Dr. Isaac, I'm so grateful that you've taken the time. I know how busy you are. You're in Texas. And so do you see clients outside of Texas, or do they have to come see you? Can you do telemedicine, for example?
Yeah, the rules about telemedicine are rather in flux right at the moment. So I'm sort of working that out on a case-by-case basis right now. But typically we've had patients come to see us from all over the country and even all over the world. I have a patient from Australia, for example. So I usually what I do is have people get started on the protocol, and then I keep in touch with them by phone for guidance.
Very good. Very good. Okay. So you've been doing this for a long time now. Has anything changed, or is it the same protocol from when you started?
Well, things are always going to change to some extent, but the bottom line basics, the ideas of using a lot of pancreatic enzymes, using different amounts of nutrients and diets for different people, the detoxification with coffee enemas, all of that has stayed the same. But there are some products that are available now that I use a fair amount of, like resveratrol, for example, just to pick one. That's very helpful in terms of energetics in the cell, and I use that with a lot of people, but it didn't exist back in Dr. Kelly's era.
Yeah, very true, very true. What about some cases that stick out? From the beginning to last year or this week or whatever. What are some cases that you are just so excited about that maybe you even thought, I don't know if this person's going to make it?
Yeah, that can happen sometimes. I guess the cases that pop into my mind, one of Dr. Kelly's patients, actually, she's one that I sometimes mention in lectures, although I think I'm trying to remember, I've already put my slide set together for Ann Fawn for this conference, but this particular woman, she was in her late 30s when she was diagnosed with breast cancer in 1969 and 1970, something like that.
Wow.
And so she had a mastectomy, and then a year later, she developed cancer on the other side and had another mastectomy. And so already this is not sounding good, because to have, that much cancer at that young an age is not good. A few years after that, I think it was 1974, she started to have back pain. And after a year's worth of it, her doctors finally did some x-rays and a bone scan and discovered that the cancer had spread into her back. It was in her shoulder blade and also at the base of her skull. So that explained why she was having so much pain, even having trouble getting dressed in the morning. So she actually had her ovaries removed. That was the only way to manage estrogen back in that era. But in addition, because she was told this isn't going to cure you, it's just going to hopefully help with the pain. So she learned about Dr. Kelly and she went on his protocol. And at the time that Nick was wrapping up his investigation into Kelly's work, this would have been 10 or 11 years later, she was feeling fine, was doing very, very well. Her back pain had resolved. And, while breast cancer metastatic to the bone isn't always extremely rapidly terminal, to be looking good and feeling good 11 years later is really quite unusual. But it gets even more unusual because in 2016, and this was shortly after Dr. Gonzalez had passed away, I decided to give her a call. She had an unusual last name. I knew where she lived. She actually lived in Florida.
Oh,
And so I went online, tracked her down, gave her a call, and she was really happy to hear from me. She was doing great, never had any more trouble with cancer. And she, at that point, was in her 80s. She did pass away in 2019, I think it was. And again, I found that online. Don't know exactly what happened, but by this point, she was in her late 80s.
wow.
So that's more than 40 years out from that diagnosis of metastatic breast cancer. So that's pretty remarkable.
I'm not asking you to give a diagnosis or advice to anybody, but in your opinion and your research, when somebody is told that they have cancer, what's the first thing that you ask that people should do? What do you suggest people should do? Because it seems like to me that people are told that they have cancer and they get rushed into fear. If you don't do chemotherapy, radiation, it's like this hypnotherapy session that you go through. You will not survive. And that's the same. And then not only there, the people around you are bullying you to also do what the doctors tell you to do. What is your advice to someone that might receive a cancer diagnosis or is now dealing with a cancer diagnosis?
Well, when that new diagnosis is given, people understandably go into a state of shock. It's reasonable, that's normal to do that. And there are a few circumstances where there is an issue that something does need to be done immediately. For example, if something is causing terrible pain or something is causing if there's an unstable bone or there are circumstances where that whole push is indicated. But most of the time you can really take a little time to think about it. I mean, not months, of course, but a few days, a week, to think about it, to do some research, to ask some questions, to really think about what you want to do. So I think that it's important to, just decide what your priorities are in that situation. And to do that, you just need a little time to think. So it's a rare thing that starting Orthodox therapy tomorrow, when you just got the news today, is necessary. Most of the time you can give it a little more thought.
And what would you say to someone who is pressuring a situation that I've been dealing with in I guess as you know, I'm a certified coach. I'm a certified life coach, and I'm seeing this more and more where people come to me because they want to be natural and alternative, and they want to deal with past traumas. They want to do all those things, but given a diagnosis of cancer, they don't want to do it, but their family's telling them to do it, and they're doing it reluctantly. And I've shared, don't do it for them. If you're going to do it, if you decide you're going to do it 100% all in. Even if it's something you don't want to do, just tell yourself that this is 100% all in. The mindset to me it's crucial. But if somebody doesn't want to follow the conventional road because maybe their path is different than somebody else's, how do you get them to kind of like, what would you advise them? What can they say to kind of give themselves more time to do the research? Because, everybody's like pushing you. I've seen it over and over again.
Mm-hmm. Well, it's a tough question to answer in some ways because every situation is going to be different. But the first things that come to me, many times when I see that in my own practice, the family members can sometimes not really have a clear understanding of what Orthodox medicine can or can't do for somebody in that situation. So the terminology that's used in the oncology world can be very confusing. So like, for instance, response does not mean cure. So the doctor is telling you, well, we get X response rate. Well, that doesn't mean cure. And so you have to ask a lot of questions. And sometimes, the patient will have done that research, but the family member hasn't. And so I wind up thinking that going back in to talk to the doctor and asking those tough questions with this family member sitting there listening might be helpful.
Very
You know,
good.
I guess and I think sometimes the role of the spouse or the role of the family member can be more difficult in a way, because they're, they frequently, don't quite know what to do. And meanwhile, the patient is saying, it's my body, I'm going to do what I want. I personally have no trouble respecting that opinion, but I know sometimes family members have a hard time with it.
Correct. Yeah,
Yeah.
and that's the thing. Families need to be in alignment with the person who is doing the treatment, and and in many cases, I've seen the family bully the patient into doing what the doctor is saying. And so, empowering your, kicking in and empowering yourself to have a voice, and not allowing fear to set in, I believe is crucial. And I think that the way the system is set up is if you want to do something different, something is wrong with you. And even if we know it's not going to prolong your life, or maybe it's going to prolong your life, but still it's not going to be a healthy life. It's going to be maybe a prolonged, very miserable life. In a situation like that, will the complementary, like doing the supplements, or what can a person that is being bullied into doing, maybe they want to do it, maybe they want to do chemotherapy and radiation, and maybe that's the way that they want to go about it. Can they take the pancreatic enzymes? Can they detox? Can they do all these things along with chemotherapy?
Well, I don't personally treat patients that are simultaneously getting chemotherapy, because I feel like the two methods of going about things are so diametrically different.
Okay.
It's I guess like the equivalent of, simultaneously to deal with the mice in your basement, you're going to buy a cat, but you're also going to throw a grenade down there. It's just the two things don't mix
I
very
think not.
well.
Yes, I think that's a great visual.
Having said that, there are plenty of practitioners out there that will advise people on nutritional support for people that are getting chemotherapy. And so there are other practitioners out there that do that kind of work. I just don't happen to be one of them. So
I think that's fair. I think that's fair. And, we just need to empower ourselves and do the research. A lot of people go into it and they just want to be told what to do. And that's not going to be good in any, I mean, I would have been like that many years ago, where just tell me what to do and I'll do it. But that to me is a path that doesn't lead to anywhere other than the doctor's advantage. So what is your outlook on people that are coming to you? I know that some doctors breathe death into them and say, oh, you got 3 months to live or 6 months to live. When people decide to follow your protocol, how much time does it take? And you've discussed several things that have given people prolonged life, and a life that is worth living as well. So what is the amount of time when somebody comes to you? Is there a particular amount of time that people start seeing that turnaround?
It's just about every patient I see asks me that, but the trouble is it varies so much from person to person that it's really hard to say. So, what I offer though is that if somebody's interested in what I do and has looked over my website and thinks that this is something they can do and want to do, I ask them to send in some information about themselves, which I'll review to see if I think this is a good fit for them. And I don't take on every patient that contacts me. There are some cases where I think that they would just physically have a very difficult time doing it because of the state of their body.
Mhm.
And there's other cases where I think that orthodox therapy has something to offer. And if I think that they've got a curative option in orthodox medicine, that's what I'm going to tell them to do.
Very good. Very good. So Dr. Isaac, for those of you who would like to learn more, you can find her at drlindai.com, and she's in Texas, and you can find her at 737-208-0831. As we close our time together, which time has just flown with you, as we close our time, any last words of wisdom that you want to share with someone who is now facing, needing to turn their health around and take their life back?
Really just to know that there are options out there, to believe that there is hope, to try to hold on to that, and not to accept anything as a guaranteed death sentence, because that's not always true.
I love that. I love that. Hope. That's what we have. That's all we have. And so once again, it's the Annie Appleseed Project. You can go to annieappleseedproject.org, or you can just click on my blog for this week with Dr. Isaac, because all the information is there. And it's February 25th, 22nd, 23rd to the 25th on 2023. There's too many 20s. And so I want to encourage you to be your own MD, be your own medical detective, see what works for you, and look at other options, because, what do we have to lose? We have everything to gain by learning something else new. So thank you so much, Dr. Isaacs, for coming on today. I know you're very busy and sharing your information.
Well, thank you for having me. I really appreciate it.
You're welcome. You're welcome. And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Linda Isaac wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking